So the National Institute for Communicable Diseases says South Africa has experienced an increase in the number of influenza cases from mid-August to early November. The NICD's monitored sentinel sites have seen an increase in pneumonia hospital cases, a cluster of influenza outbreaks at schools, workplaces also being reported. So the relaxation of non-pharmaceutical interventions to control the spread of the virus, of COVID-19 that is suspected to be behind the cause of this spike. But let's speak to Wits University's vaccinologist, Professor Shabir Madhi, who joins us now for more on this story. Prof, it's great to have you with us on the program. Thanks so much for giving us some of your time. So you're surprised by this spike in influenza cases. And, you know, Prof, I perhaps want to just begin with, how do we understand this latest, shall we call it, spike in infections, when last year it does appear that, or shall we say this year, June, it appears that we missed our usual spike of flu cases because of COVID-19?
So good morning. Thank you for having me. So when it comes to influenza, South Africa is not unique in that over the past 1.5 years, there's been a complete disruption of the circulation of influenza. And the previous seasonality that we observed, where influenza usually starts off around about May, June each year in South Africa and continues right through to about August, that sort of circulation of the virus, an epidemic type of curve, was disrupted. And the reason for that disruption is because of the social restrictions that were imposed, as well as the type of travel bans that existed, which limited the movement of people and consequently limited the ability of the virus to seed in different places. So like I said, in fact, with influenza as an example, there's 4 different type of strains that are usually of concern. And over the past 1.5 years, one of those strains has completely disappeared globally, not just in South Africa. Now that we're beginning to see a resurgence, not a resurgence, but that we're beginning to see influenza starting to take place again doesn't come as a complete surprise because, as we know, our borders have opened up, social interactions have increased, and what we would expect is for there to be an increase in circulation, not just of influenza, but many other respiratory viruses as well. What is unusual is the time period of the year during which the circulation is taking place. It's very unusual in South Africa for influenza to be circulating and causing this sort of outbreaks during the summer period, which is what we're heading into. But I think the entire epidemiology, the pattern of influenza circulation and who is being infected when, has been disrupted because of the non-pharmacological interventions, coupled with the travel restrictions that were in place over the course of the past 1.5 years.
So, Prof, can I ask you, what does it mean for the pattern of the virus if we miss the May, June, July spike and it happens in the summer months? What does that mean?
Well, it's difficult to predict. In fact, the influenza outbreak that the NICD is referring to in Gauteng as an example, based on our own surveillance in Soweto, it's actually on a downward trend now. In around about the last month or so, the positivity rate, the percentage of people that were being investigated that tested positive was above 10%, and now that's gone back to below 10%. And it's nowhere close to the past epidemics that we've experienced, when during the course of the influenza outbreak, the positivity rate goes up to about 40 to 50% at times. Now, what we would expect is that it's not going to, so this particular epidemic that we're currently experiencing in South Africa probably is less severe than epidemics that we have experienced in previous years before COVID. So it would mean that there will be hospitalizations, but probably less than what we experienced previously. In terms of who ends up being hospitalized, the risk factors for hospitalization after a person has been infected with influenza is not too dissimilar to the risk factors for COVID-19, except in the case of children. So especially children under 1 year of age, they are a risk group of being hospitalized for influenza as well.
And I suppose people who are listening to you this morning who might be suffering from symptoms, the question would be, you know, how do I know that the symptoms I'm experiencing are indeed due to influenza and not COVID-19?
Yeah, so unfortunately, there isn't any good clinical way to distinguish between the two. So you really would need to be tested to determine whether you're infected with influenza virus or with the SARS-CoV-2 virus. So clinically, there isn't much that differentiates the two. Both of them can present with very non-specific symptoms, such as a fever, a sore throat, a cough, bone, muscle pain, muscle aches, etc. So there isn't any clinical way to distinguish between it, and especially in a place such as Gauteng, where we're beginning to see the start of the fourth wave of COVID-19, what we would be experiencing is co-circulation of those two viruses. So again, in absence of circulation of SARS-CoV-2, if there was only influenza circulating, you could sort of have some level of certainty that it's influenza rather than COVID. But when both of these viruses are circulating concurrently, other than being tested, there's no other clinical way to distinguish between the two infections.
I'm glad that you mentioned the seemingly increasing cases of COVID-19 in Gauteng, Prof. As you say, the daily tally, 332 infections, no other province in the country overnight experiencing more than 50 new COVID-19 cases. So you reckon we're starting on the fourth wave in Gauteng?
Unfortunately so. It sort of is somewhat aligned to what was being predicted, that we likely would be experiencing a resurgence sometime in December. So we probably will start seeing increases in hospitalization in the period of the next 2 to 3 weeks. But the magnitude of that increase that we would see probably is going to be less severe than what we have experienced during the course of the past 3 waves, because of people being vaccinated, but also because of a high force of infection that has already taken place. A large percentage of the Gauteng population have already developed some level of immunity, at least against severe disease, because of natural infection. So those two things put together would result in this resurgence, resulting in fewer case rates, severe hospitalization, as well as death than what we experienced in the past. But it could be much better if we were able to increase.
Our apologies, we do seem to have lost our connection there with Professor Shabir Madhi, who is a vaccinologist at Wits University. But I think the point that he was getting to is the issue of those non-pharmaceutical interventions. Of course, we're not going to be in a position where we implement another lockdown, given the impact on the economy. But if you continue with sanitizing, wearing your masks, social distancing, that should help. I'm just checking with control whether we do have him back on the line. He is back on the line. Prof, shall we just wind up our interview? And you'll correct me if I'm wrong. You were talking about, you know, the fact that we are seeing the beginnings of level 4 of, the fourth wave of infections in Gauteng. We're not going to go back into a lockdown, Prof. It's those non-pharmaceutical interventions that we need to really keep to.
The most important interventions is avoiding indoor overcrowding in poorly ventilated spaces. The hygiene and that plays a nominal role in being able to limit the spread of the virus. It's about the indoor gatherings that we need to focus on, and people need to ensure that they're wearing face masks when they're in those overcrowded indoor spaces, and there needs to be good ventilation. But the most sustainable way that we can avoid a lockdown is to ensure that people are protected against hospitalization and death. And the way to do that is to ensure that high-risk individuals in particular are adequately vaccinated.
Professor Shabir Madhi, let me thank you for your time this morning on the program. Thanks so much for giving us your time. He's a Wits University vaccinologist as we talk all things influenza. There does seem to be a spike in influenza cases, which of course is months later than where we ordinarily see a spike in flu cases, which is usually in the winter months, now seeing it in the summer months. And of course, that's as we continue to take stock of our COVID-19 figures as well, the beginnings of a fourth wave in Gauteng already.